Hello lovely people, welcome to my channel. Today's discussion will be based on stroke. Stroke is one of the life-threatening medical conditions which can suddenly occur as a result of your brain being starved from needed nutrients. In case there is interruption or there is reduction of blood rich in oxygen supplying to your brain, that means your brain is going to starve from oxygen and there will be a damage to your brain which will have a result or a symptoms called stroke. Patients with stroke or suffering from stroke are very worried. They always ask questions about why are you talking about my brain being affected, and right now I'm not able to make movements, I'm not able to walk, I'm not able to swallow food, I'm not able to speak clear, I'm not even able to see things well with my eye. Why? The reason is your brain is taking control of your whole body. Like your brain is taking care of all your body, and for that matter, should anything happens to your brain, it's going to show a result on your body. The whole brain, each part of your brain is taking care of a special part of your body. Yes, so let's say if that special part of your brain or the department taking care of your eye is being damaged, is there that is starving from needed nutrients, that means if it's damaged, your eye is not going to be able to work as usual. Or in case that part was taking care of your leg, helping in movements, if there is damage or they're being starved, it's not being able to work as it's used to, and now it will have a result on your movement. So whilst the brain is damaging, you will be seeing some symptoms, or whilst it's starving from such needed nutrients, you will start seeing some symptoms like you will be losing balance, you will become confused, you can even lose memory. So if such signs are being shown, you have to think very well and start seeing for medical attention. It can even progress in a way that there will be a drooping of half of your face, you can't be smiling well, there will even be weakness of your arms, you can't even lift both arms at the same time, you can't also be, let's say, speaking well, there will be unclear speech, you'll be coming with such speaking, and it can be that like there will be changes which is physically seen by even someone else and you yourself. So you don't have time at your side at that moment, you have to rush, either if it's the ambulance that will help you to reach hospital very early because it's an emergency case, you have to do any reason means you can reach hospital as early as possible, because your brain can't even survive more than 6 minutes from oxygen. Whilst it's not getting needed nutrients, your brain will die. So the earlier you get to the hospital will come out with your healing also. So if you stay home, you waste time, the more you waste, the more your brain also will be damaging, and it can get to a stage where the cells of your brain will even damage permanently. That means you will become disabled for the whole or the rest of your life. So don't waste time and see for medical attention. Let's talk about causes of stroke. What at all causes stroke? Before we will talk about causes of stroke, we will first of all talk about the type of stroke and how it occurs. There is ischemic stroke. Ischemic stroke is very common among patients suffering from stroke. About 85% of patients suffering from stroke is ischemic stroke, and it's a situation whereby there will be buildup of fatty or maybe clotted blood which can even travel from any part of your blood vessel and lodge in a particular vessel which will be supplying blood rich in oxygen to your brain for it surviving and it's working. And when that happens, it will cut off the needed nutrients to your brain. It's just like whereas there is rainfall and let's say there will be a tender strike into your house and it will be disconnecting some wires. The moment it happens suddenly, everything will be off. Your television, the moment it gets into any wire which has been connected, it will cause disconnection. That's how it is. But the only difference is at any point in time the electrician can't fix it, but for the brain it's not at any point in time. The early you get to the hospital, that will come with your results of healing, so you don't need to waste time. That's ischemic stroke, so build up of fat and clotted blood. And also talk about hemorrhagic stroke. Hemorrhagic stroke is not all that common. About 15% of patients suffering from stroke are that type, and it's okay when there is rupture or there is bursting of the blood vessel, which will lead to leakage of blood into your brain, causing the brain to swell, and it will have damage to your brain and a results called stroke or symptoms called stroke. This can be seen among people who had accidents like car accidents. Because of that trauma, maybe there will be a burst of the blood vessel and it will cause the leakage and lead to the swelling or damage of your brain. And people having aneurysm, like they will have a bulging at a weak spot of their blood vessel, which can also cause rupturing of the blood vessel. Hypertension, if you are hypertensive, it can also cause uncontrol of it, and there can be a rupture or bursting of your blood vessel. People with diabetes